Hi everyone, Dr. Alvarenga here with my friend Joseph. Joseph is my trainer and also a coworker of mine at Body Mechanics. And we're here at his outdoor gym. We're going to talk about some basic subluxation analysis tests that you can use on your soap notes to justify finding a segment to adjust. And so we're going to talk about cervical syndrome, Atlas challenge, Dvorak's flexion and extension, seated Gillet's, and the Derefield test. And so since we're sitting, I'm going to start with the Dvorak exams. Dvorak tests can tell you whether a patient is likely to have an upper cervical or a lower cervical subluxation. And we have two versions of this test. The first is Dvorak's flexion. So Joseph, what I'm going to have you do is tuck your chin down towards the chest. And now what I want to do is turn his head left to right to see if there's a restriction in either direction. So I'm just going to take hands on either side of his head and we're going to tilt. We're going to tilt. And I'm looking for whether or not I feel restriction and if his head clearly turns more in one direction than the other. Okay, you can relax, back to the middle. And that's just going to give me a general sense of whether there is a restriction on the upper cervical spine. Right, so we're looking at occiput on Atlas and Atlas on C2 with Dvorak's flexion. If we do find a restriction in a particular direction, we would label that as DVF positive and the direction left or right. Now Dvorak's extension is going to tell us whether we have a possible subluxation in the lower cervical spine. And so for Dvorak's extension, Joseph, I'm going to have you look up towards the sky. Good. And same idea. I want to turn and turn. And I'm feeling a little tiny bit more restriction as we go to the left. And he goes a little bit farther to the right. To middle, and you can relax. And so that tells me he may have a subluxation in the lower cervical spine that's keeping him from turning left. So in our diversified terms, that's a possible body right, but we need to do our motion palpation to determine that for sure. So that's our Dvorak's flexion and Dvorak's extension. Dvorak's extension you would list on your soap note as DVE positive and the direction. Okay, so now we're going to keep going with the cervical exams and then I'll have him sit up again and we'll do seated Gillet. So I'm going to have you lie down face up. Okay. And so when a patient is lying down face up, we can do our supine leg check. So I'm going to scoot over to the end of the table. I'm going to put his feet into dorsiflexion as much as possible. And now I'm looking at either the height of the ankles, right, a difference in the medial malleolus, or the heels. And now, depending on your patient's history with ankle injuries or foot injuries, we may need to use one or the other. If they've broken their ankle, sprained their ankle, that may not be the best place to check. And so I'm looking for a short leg, and in this case, we've got a supine short leg on the left. And now I can follow up a supine leg check with the Atlas challenge. And so what I'm going to do is a pressure test on the Atlas, asking his brain if it would like me to move his Atlas in a particular direction. So I'm just going to take a contact right at the transverse process of the Atlas and push gently lateral to medial. It doesn't matter what side you do this on to start. And let's see if that evens out the feet. Not really. So it's kind of a no to a left Atlas. Let's try it on the right. Find the Atlas, go right up under that mastoid process, and push gently straight lateral to medial. And that does even it out a little bit. Okay, so we've got a little bit of laterality on that side. Now let's see if we've got rotation. I'm going to do a light P to A swipe along the transverse process. So, swipe. And again, it's just a suggestion to the brain. Would you like me to rotate in that direction? That's a no. It does not clear. Let's see the other side. Swiping P to A on the opposite side. Now that definitely evens it out. Okay, so now we even out the legs by pushing lateral to medial from the right and swiping P to A from the left. So if it's posterior on the left, that means it's anterior on the right. His listing is a possible ASRA Atlas. Okay, so pair that with Dvorak's flexion, and now I've got two findings to potentially adjust the Atlas. All right, Joseph, I'm going to have you go face down.
Okay. That's really interesting.
All right, and now we're going to look at our cervical syndrome test, which comes from a prone leg check. The prone leg check we're going to use again later on when we do Derefield. But from a cervical syndrome, I can tell if there is a rotation in one of the cervical segments that might be causing a torque down the spinal cord that would create a short leg. So let's see. We do our 6-point landing. You guys might have heard of this in drop table, right, or an activator. So 6-point landing, thumbs underneath the heels, middle finger across the cuboid, index finger going up towards the lateral malleolus. I'm going to put a little bit of headward pressure, and I'm going to look for a difference in leg length, left to right. Now he has the tiniest difference with a slightly shorter left leg, very small difference. I adjust him a lot, and he's in great shape, so he doesn't really have much going on. And so for cervical syndrome, what I'm going to do, Joseph, I'm going to ask you to turn your head to the left. Give that a second to settle. And when I do my contact again at the heels, his legs evened out. That's a positive, right? So that's a cervical syndrome positive left because he's facing left. So now I'm going to come up to the cervical spine, and I can go to either side, but what I'm going to palpate is the right side of his cervical spine, the side that is down, and see if I can find a nodule, right? Or basically a segment that feels like it's pushed back farther than the others, one that's sticking out. Might be a little sore too. And I'm feeling a little bit there on C5. So this is a positive for a C5 body right. Interesting. When we did our Dvorak extension, we had a positive left telling us we might have a body right subluxation. So those are my 2 out of 3 findings to be able to adjust C5. Let's go back to middle. Now, if the legs did not even out when he turned to the left, I would have him come back to middle, take a breath, and then turn to the right, and we would test the right side. There is also a variation of cervical syndrome, and you guys will learn this in drop table. It's not super relevant for Diversified, but where the legs start out even, but if you turn in one direction or another direction, it changes. You'll learn that one in drop table. We don't use that one so much here. Alrighty, so while we're here in a prone leg check, let's move into our pelvic exam, the Derefield test, which is a hallmark, a staple of Diversified analysis. I'm going to do my regular prone leg check. So what you might see me doing here was swiping down the calves. This is just sort of clearing any input out. So any tests that I've done, I just sort of clear out back to a neutral stage for him. So again, I do my 6-point landing, and he's got that little bit of a short left leg. Now what I'm going to do is bend his knees, bring them up to 90, and see if that short leg gets longer or if it stays short. Like that. So we go from short to long on the left side. So short to long gives me a possible SI joint subluxation that I would address from the ilium side, right? Telling me we potentially have an ilium listing. So left short to left long is a possible PI on the left, but because the pelvis is a ring and moves as a unit in these figure 8 patterns, he could have a PI on the left, or he can have an AS, anterior superior, on the right. I need other tests to tell me definitively which side that I should adjust. Now, here's my personal little trick. You don't put this on a soap note, it's just a thing. Similar to Atlas Challenge, I would ask his body, what side would you like me to adjust? You'll learn this in Activator. You can do a downward swipe from the PSIS on the potential AS side. Does that even the legs out? That's a yes. If it evens the legs out, that means I can address this from the right side as an AS. Can I address this from the left side as a PI? Let's see. Legs stay short, or if they get even short, if it gets even shorter, that's a definitive no. This subluxation does not want to be addressed from the left. I would treat it as an AS on the right. Okay, Joseph, I'm going to have you sit up. And let's let's actually have you face the other way.
Other way?
And so I know you guys are pretty familiar with standing Gillet because you learned that a lot in Gonstead. The seated Gillet is a variation where we're looking at the movement of the SI joints relative to the spine, and it's going to tell us generally if there's a subluxation on either side. So what I'm going to do, I'm going to bring your shirt up a little bit. I'm going to find his PSIS. It's the easiest way to do that. Find the iliac crests, follow to the middle till I find bubbles. So from here, I've got a thumb on the PSIS on either side. Joseph, I'm going to have you reach down like you're touching your toes. And as you might be able to see on the camera, come back up. My left thumb rises up real fast, keeps going, whereas my right thumb rises up a little bit and then stops. Ideally, I want it to rise up a little and then stop so the spine can keep going by itself. In this case, his left SI is fixated potentially. Now let's try the bottom of the joint. Right, so SI joint is about 2 inches long. I'm going to come down to the bottom of the joint and we'll do the same thing. Reach down, touch your toes. Both sides move. Come on up. And back. And over. Thank you. So both sides moved at the bottom of the joint. So we've got potential fixation on the left. Now my Derefield told me right. I'm going to have to motion palpation that to see exactly which side I need to adjust. Thanks, guys. Those are our basic subluxation analysis tests.